COVID-19 has reached almost all parts of the world. Just when we thought we were getting away from COVID-19, Omicron emerged. Since it has emerged in mid-November, Omicron has spread across the globe like wildfire. Though it has milder symptoms, almost the same as seasonal flu, the World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease, and there are reasons to worry about it. People with diabetes and heart disease can face severe complications. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. So if you have any questions you would like to ask our experts, please send them to us via WhatsApp. The number is +91 9167 666 941. Also, please send us your name and your location. Let me introduce our guests with you. We have with us today Dr. Arindam Ray, MBBS, MD, DM Endocrinology, Assistant Professor of Internal Medicine at College of Medicine and Sagor Datta Hospital, Kolkata. Dr. Trimcy Tyagi, MBBS, DNB, Fellowship in Diabetes, PGT and Advanced Diabetes Care and Clinical Endocrinology Consultant, Physician and Director, Javisha Medical Center, Lucknow. And we have Dr. Anoop Gopinath, MD, DNB, DM, DNB, CARDIO, FSCAI, FESC, HOD, Interventional Cardiology, Rajiv Gandhi Cooperative Hospital, Palakkad, Kerala. Thank you all so much, doctors, for joining us today on this very interesting conversation. Starting with you first, Dr. Ray, the reduced severity of Omicron is good news for now, but reports are coming that the next variant could be even more virulent. Is this true? Because obviously a lot of people want to know this.
Yeah, you're absolutely true that this Omicron variant has been, the reduced, the incidences are there, and but we have to be stringent that people with different comorbidities, the elderly people, people with uncontrolled diabetes, hypertension, the cancer therapy or immunosuppressive therapy, they have some form of severe disease even with the Omicron. So that's it's behaving actually like as you have said, like a seasonal flu. But the new variant that has been diagnosed in most probably in this neocov. So that is found. That is all found in the bat. So the human infection is still not there because it's using a different receptor. That is the point of entry, and it's called the DPP4 receptor. But the ACE2 receptor is not available there. So if the mutation is there in the next, then it can probably affect the humans. But still, no human disease is not available yet with the research paper. So it's a variant of the CoV2 that's still there for the last 10 years, but we have to be cautious. But WHO already said so.
I think being cautious and keeping fingers crossed. Dr. Tyagi, as we all have seen, the Delta variant of COVID-19 was more severe, and it also takes more time for recovery from infection. What is the recovery time for the Omicron variant, and what protocol should people follow in case they are infected with Omicron?
As you said, Delta was more severe. In Omicron, most patients are asymptomatic or with mild symptoms like upper respiratory tract infection, sore throat, nasal congestion, low-grade fever, and sometimes severe headache and extreme weakness is the only symptom. As per symptoms, recovery time is mostly 3 to 5 days, but patients should follow certain protocols, being a positive patient. And these are the protocols like first isolation. Patient should isolate him or herself as soon as possible he diagnosed positive as a case of positive Omicron from the family and community. All the family members at the residence should follow the protocol, home quarantine protocols, and all the family members including patient should wear mask, because if the patient and family is already exposed to the patient, you never know who will be the next symptomatic carrier among the family.
Yes.
And next is monitoring of temperature. That is very important for the patient as well as other family members. It should be done for next 3 to 5 days. Okay. Any auxiliary temperature more than 99.5 considered as fever, which need immediate attention. And monitoring of oxygen is very important. As per present scenario, patient in Omicron having good oxygen saturation and maintaining it. But there are few patients like chronic lung disease and immunocompromised patient. If your oxygen going below 93 or 3% lesser than your normal routine values, then you need attention. You should consult your doctor.
Okay, so
And cross ventilation of the room and quarantine space is also important thing.
Okay, so isolation, mask, and of course taking care of the symptoms and treating those symptoms.
Yeah.
Dr. Gopinath, what is a vaccine booster dose and how does it help your body's immunity toward COVID-19? And if you can tell us what really is the difference between a booster dose and a third dose?
Yeah, COVID booster dose, usually in India, 2 vaccines are basically given, that is Covaxin as well as Covishield. So a dose of vaccine given 9 months after the second dose is called as the booster dose.
Okay.
The reason for this is because many studies have shown that with time after the last dose, after 6 to 9 months, the antibody levels fall very rapidly. And after this, because there is newer strains coming, if you get infected, there is a chance of severe disease and ICU admissions happening. So if you take a booster dose, the antibody levels increase 10 times above that of normal, and you're protected from reaching the ICU or you get a severe disease if you are infected. So there is a protection from severe disease once you taken the booster dose of vaccine.
Okay.
The difference between the third dose and the booster dose is that the booster dose is given for a person whose immune system is normal. So if you have a person who is immunocompromised, like those on renal transplant or those who are transplant recipients or those who are on cancer chemotherapy, the antibody levels in them falls rapidly after giving the second dose. So they may have to take a dose maybe 1 or 2 months after a second dose. So this is called as the third dose.
Okay.
So it's only a basic difference is only in the terminology. The dosing of the vaccine, everything is the same.
Okay.
One, you give it immediately. The other, it's only for a fading immunity you give, that is the booster dose.
Okay, I think thank you for explaining that really well, and obviously which also means like vaccination booster is again very key. Dr. Ray, after recovering from COVID for 8 days, my son aged 31 is doing well. So what is the best diet and exercise regime that you recommend? So this is a WhatsApp question from our viewer. Salim from Srinagar is asking for his son.
Yeah, actually, what we suggest that the exercise that actually depends on the patient's ability to, go out of bed and how he's performing, what is the oxygen saturation level. So if it's absolutely okay, then we can suggest some mild exercise, definitely. But if the oxygen level is not so and patient is not able to do, then resistant exercise that we can suggest.
Okay.
From the diet point of view, it's very important that the patient has to take a lot of fluids. So fluid intake should be in a good amount, at least 3 to 4 liters per day. And it may include some juices, some soup kind of thing. And protein intake should be judicious. So he has to take every day some form of protein, like the egg, chicken, fish. Otherwise, the vegetables that has to be taken in a good amount. Carbs you can take, and fruits are very important, particularly fruits those carrying high amount of vitamin C, like lemon, samla. That has to be taken in a good amount, so that the patient has to take vegetables, fruits, fish, the proteins.
Yeah.
So these are very important from diet point of view, and patient has to take a small amount of food in very frequently rather than taking a large amount in a big gap. So that should be suggested.
Yeah, so food at intervals, as well as the right kind of food, like you said, fruits, vegetables, and of course the right kind of exercise as well. Dr. Tyagi, people who have recently been diagnosed with diabetes or pre-diabetes hope to stop medication in future by making suitable lifestyle changes. So very simple question which a lot of people keep asking, is diabetes reversible, or do people have to take medications lifelong?
Let's call it remission rather than reversal, because reversal sounds like it is a permanently cured status, but it's not true, because we put our diabetes into remission through a very accurate lifestyle modification, which comprises of healthy dietary habits with proper meal plan, lifestyle, exercises, workup schedules, and proper medication which your doctor is prescribing you right now according to your current sugar levels. And through these steps, and with few healthy habits, like if you're a smoker, you have to stop smoking, or you're alcoholic, you have to limit your intake of alcohol. Yes, as per recent studies till date, weight loss is a very good contributing factor in putting the diabetes into remission. Studies suggest if you start working towards your weight loss as soon as you diagnosed your diabetes, it can work out. It will help you to put your diabetes into remission. But weight loss should be healthy through lifestyle modification. Not you should not crave yourself or starve yourself for meals, but it should be like under guidance of proper healthcare team.
Okay.
And your exercises and workout schedules.
Okay, so reversal is not it's not possible, but remission is. I think that's really well explained. And of course,
as long as you will practice this lifestyle modifications in your life.
Like you rightly said, it's the exercise, the diet, losing weight, doing the right things and following a good lifestyle, healthy lifestyle. Dr. Gopinath, tell us, what are the signs that one has a heart problem, that one gets to know they're having heart issues and should see a doctor? Also, can you tell us the difference between breathlessness caused by heart problems and lung problems? This is also a question from our viewer, Insha from Lucknow wants to know.
Yeah, the most important symptom that usually everybody knows in a cardiac disease is, of course, chest pain. So anybody who starts having a chest compression while walking, or there is a pain radiating to the left upper limb, you should go and meet a doctor immediately. So if you are breathless on your routine activities, like you climb stairs, you are feeling breathless, or you walk on a straight line and suddenly you feel breathless, you should meet a doctor. Then other symptoms that you can come across is palpitation. Sometimes, the most dangerous symptom that anybody can have is a heartburn, because once you have a heartburn, there's recurrent episodes of heartburn. You sit at home waiting 4 to 6 hours on antacids, and that is the active time in which a treatment for a cardiac disease can be given, and you're losing it. The biggest problem with heart disease is that it's a lifestyle disease. So majority have severe disease without any symptoms. Okay. So it is mandatory that if you are above 30 years of age, if you have diabetes for more than 5 years, if there is a family history of heart disease in family, you should go for a routine evaluation, do a stress test and find how bad your arteries are.
Yeah. So routine checkup is key, and again, not to making sure that you're not avoiding or overlooking any symptom. I think on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Ray, no matter what type of diabetes one has, it does lead to excess sugar in the blood. Too much sugar in your blood can lead to serious health problems. How does this excess sugar in blood cause damage to the body, and why is it essential to control blood sugar?
Yeah, blood sugar more than a particular range, and what we call as the target sugar of 70 to 180. So more than 180 milligram per day sugar, that is dangerous for many of our organs like the heart, particularly the vessels, the kidney, retina, nerve. And at the same time, poor glycemic control, the poor blood sugar actually also deteriorates the immune system. So considering the fact that the COVID situation is there, so if we have to control the blood sugar to boost our immune system, to protect ourselves from inside the body, at the same time to protect the organs. So chronically elevated blood sugars damage these organs in the form of nephropathy, retinopathy, neuropathy, and same time increased chance of heart attack and stroke. So to protect the organs, definitely we have to control the blood sugar with the lifestyle change and medications.
Okay. So, now, Dr. Tyagi, since we've understood we need to, control blood sugar, can you tell us how can one control fasting blood sugar levels, especially during pregnancy? Because this is a question which one of our viewer wants to know. It's come via WhatsApp.
Fasting blood sugars are very crucial and hard to tackle, one of the most hardest thing to tackle in pregnancy. But there are few practices which are possible for patient to follow in day-to-day routines. Like a balance between evening meal and light dinner meal is very important, because patient can't skip the dinner, because it will again hamper their blood sugar levels. So patient should take good nutritious portion in evening meal balanced by the light dinner meal, and patient should take a little walk after evening snack. That will help in blood sugar management and metabolism. But few patients who are having hypertension or heart disease, they are not recommended these lifestyle exercises during the pregnancy. They should do under the guidance of the doctor. Other thing is hydration. They should maintain their hydration very properly during pregnancy, because dehydration in itself is a triggering factor for high blood sugar levels, and water flushes out your extra sugar from your blood. And third thing is sleep. how you're sleeping these days during pregnancy, because in normal pregnancy also women get disturbances their sleep pattern. So in diabetes it is more.
Okay.
So good sleep will relieve your stress factor and will help you to manage your blood sugar levels.
Okay.
And carbohydrate portions should be less than the half calorie of your total diet
Okay.
in the day. And
Yeah, so
protein
these are
should be
tips,
lean protein.
These are tips which can easily be followed, whether it's hydrating your cells, sleeping, and this will really help pregnant women.
Yes, after all, if patient is struggling with fasting hypoglycemia, they should consult their doctor for the addition of medicines and insulin, which is very important.
Okay, yes, that's the most important, I think. Dr. Gopinath, many people get confused about heart attack and heart failure. Can you please explain the difference between the two of them?
Yeah, heart attack is a condition where one of the blood vessels supplying the muscle of your heart is 100% blocked by a clot. Heart failure is a condition where the muscles are weak or they are stiff, they are not able to pump out sufficient amount of blood. So when a person comes with a heart attack, usually the presenting feature is a chest pain, whereas those presenting with heart failures, usually breathing difficulty is their main problem.
Okay.
Now, one of the causes of heart failure is heart attack. So there are various other causes for heart failure. Like if you have a post-infective state, you can go into a heart failure later on. If you have a kidney disease, it can lead to heart failure. So there are many number of causes for heart failure, one of which is only a heart attack. So the difference is that heart attack is basically a disease that affects the vessel of your heart, whereas heart failure is something that affects the heart muscle.
Okay. So I think it's really explained well. Dr. Ray, okay, again, how accurate is home monitoring for blood glucose? And is there any need to do an HbA1c test if a person is regularly monitoring their blood glucose at home? How important is actually HbA1c?
Yeah, HbA1c actually gives you the result of last 3 to 4 months average blood glucose. So fasting and TP sugar checking by glucometer is, more or less accurate, better for the fasting sugar, less for the PP sugar. So fasting reports usually get 10 or 15 milligram per DL. That difference is there with the laboratory report. But even with the glucometer readings, there is a control fasting PP. We have to check the HbA1c to see whether the HbA1c is actually less than 7 or 6.5. That is the target. And that we have to do to check the full glycemic control patient have actually or not. So that is very important. So HbA1c has to be done, particularly for the patients to check the control fully.
Okay.
And for glucometer reading, that is very important, particularly for the patients who are taking the insulin, but the patients who are on oral anti-diabetic agents, it's not necessarily to the glucometer reading. If the patient feels symptomatic of hypoglycemia in sometimes, then definitely she should check the blood sugar, and if it's less than 70, then oral glucose or something like that has to be taken.
Okay.
So that is very important for the patients who are taking oral tablets. At least 3 to 4 monthly laboratory testing is very important. That is the fasting sugar, PP sugar, and
I think
HbA1c.
that's a very important point, because even if you're taking your sugar level at home, like you rightly said, HbA1c is still essential every 3 months. Dr. Tyagi, hypoglycemia is common in people who take insulin injections. What could be the reasons, and is this preventable?
Hypoglycemia is always the other side of coin in every diabetic patient, but it's more common in insulin injection. That's true. And the main reason is the mismatch between the insulin doses and the dietary patterns of patient. Either he is taking too much insulin according to their need, or they are taking less diet and meal according to their insulin doses.
Okay.
In such patients, we advise patients should never skip a meal. They should follow the typical diabetic diet, which is 6 meal regime, 3 big meals and 3 small snacks. And they should adjust their insulin doses according to their physical exercises or increased physical activity in recent days. And if after all these things they are not able to tackle this problem, they should consult a doctor for any other secondary causes to these frequent hypoglycemic attacks. Like there can be some infection or slow kidney impairment, or some other endocrine disease or disorder which is happening there in body. So patient should always try to tackle down through lifestyle modification, then consult a doctor for proper guidance.
Okay, so first is lifestyle modification, and then still if it persists or continues, then to please visit a doctor. Dr. Gopinath, as shown in many movies and TV shows, most people believe that the only symptom of a heart attack is severe chest pain. What are the other symptoms of a heart attack? And one should really know that when they need to visit a doctor.
See, the biggest problem for us cardiologists treating is these movies show chest pain as the predominant symptom. So when they come to us and when we tell them it is a heart attack, they're not ready to accept the fact that it's a heart attack. So there are many silent atypical symptoms that you can detect. So sometimes you have a pain in between your shoulder blades that is episodic. You have a left arm pain. The pain comes and goes. Or you have a neck pain that comes and goes. Initially shown to an orthopedician, then referred to a cardiologist for further evaluation. Many patients usually present with heartburns, and recurrent heartburns are also one of the conditions where a patient usually visits a gastroenterologist, and then finally he comes to know that there is nothing on an endoscopy, and then comes to the, whatever symptom. If all these symptoms are associated with severe sweating, diaphoresis, and very severe tiredness, you should suspect that there is a heart attack going on. And basically, it is never for the patient to decide the symptoms. It's better to go with any such symptoms. Even if it is an anxiety attack, you should go to a doctor and let the expert decide whether it is a cardiac problem, whether it's an anxiety disorder, or this is a medical emergency. So you should always reach the hospital in time.
And not take it lightly, like you rightly said. Dr. Tyagi, we've spoken about diabetes, heart attack, but another issue, what we're facing today is obesity. And also this is obviously related to the right eating, exercising, a healthy lifestyle. So obesity is leading to a lot of issues, but what about the younger generation? Because we're seeing a lot of young people also, who are prone to diabetes as well as heart diseases.
These days, childhood obesity is also becoming an epidemic. More children are getting this obesity, and these are the main problem are their dietary habits.
Yes.
People are more towards this junk food and quick prepared food, already ready to eat food. These food are the sole reason for childhood obesity. But we really need to take it very seriously, because nowadays we are getting our diabetic patient in the age group of 30 and 40, more than 50 and 60. These days, many patients are coming in this age group. And the sole reason is obesity only, which I am seeing these days, like fatty liver. Like grade 1, grade 2 fatty liver is very common in today's scenario, which is leading this development of diabetes in next 5 to 6 years, slowly and slowly.
Yeah.
So there are many.
Key here, I think doctors, is that we catch the children young. I mean, we make sure they don't eat wrong. I mean, junk food is something like you rightly said. And there's so many things I think which one needs to start working on it now, so that they can stay away from diabetes as well as heart diseases. Thank you so much, doctors, for joining us and sharing your expertise with us. And for our viewers, if you have any questions that you would like to ask our experts, please send them to us via WhatsApp on the number. The number is +91 91 67 666 941. Also send us your name and your location. Thanks so much for watching, and news will continue on the other side.